In this episode of Concussion Corner with Dr. Brian Hainline, we spend 25 minutes together discussing the origin stories of the CARE Consortium, collaboration between 30 NCAA schools across 26 sports, and every single military academy in the United States. The importance of inclusivity in medical research, discussing the historical inequities across men and women, highlighting a timely U.S. Open presently here in New York City, celebrating 50 years of equal prize money, and giving one of my favorite athletes, Billie Jean King, a shout out. And finally, why all of this deep and collaborative work is important to the society at large for concussion research and the importance of physical and cognitive dominance for our military members. With that being said, welcome to episode 77 of the Concussion Corner podcast. Enjoy.
Are you a healthcare professional looking for a trusted concussion resource? Then you've come to the right place. From her New York City studios, welcome to Concussion Corner with your host, Dr. Jessica Schwartz.
And now, a word from our sponsor. Did you know that sport helmets are rated on a 5-star system similar to cars? And the safest helmets have nothing to do with price, brand, or availability? Since 2011, Virginia Tech researchers have been providing unbiased helmet ratings that allow consumers to make informed decisions when purchasing helmets. The helmet ratings are the culmination of over a decade of research identifying which helmets best reduce concussion risk. This work is done as part of Virginia Tech's service mission and is 100% independent of any funding or influence from helmet manufacturers. Our mission at Concussion Corner is to expose you, the listener, to trusted spaces in the concussion arena that translate to clinic next day. Please visit the Virginia Tech Helmet Lab website in our show notes or at bit.ly/Virginia Tech Helmets and spread the word to aid in lowering concussion risk in your community. Thank you for tuning in, and let's begin the show. Welcome to Concussion Corner. My name is Dr. Jessica Schwartz, and I'm thrilled to have Dr. Hainline back with us for episode 77. Dr. Hainline is the Chief Medical Officer of the National Collegiate Athletic Association, also known as the NCAA, and he also serves as the USTA Chairman of the Board and President. As the NCAA's first Chief Medical Officer, Dr. Hainline oversees the NCAA Sport Science Institute, which is a national center of excellence whose mission is to promote and develop safety, excellence, and wellness in collegiate student athletes, while fostering lifelong physical and mental development. The NCAA Sport Science Institute works collaboratively with member schools and centers of excellence across the United States and works in partnership with the Department of Defense for the NCAA-DoD Grand Alliance, the largest and most comprehensive concussion study in history. For over 30 years, Dr. Hainline has been actively involved in sports medicine, including serving as Chief Medical Officer of the U.S. Open Tennis Championships and the United States Tennis Association, where he is presently president. He is co-author of Drugs and the Athlete and played a pivotal role in the rollout of drug testing and education worldwide. Dr. Hainline is co-editor of the recently published medical book, Sports Neurology, which provides an in-depth academic overview of concussion and repetitive head impact exposure, as well as the interplay of the nervous system in sport. He served as co-chair of 2 International Olympic Committee consensus meetings, 1 on pain management in elite athletes and 2 on mental health in elite athletes, both of which led to consensus and subspecialty publications. Dr. Hainline is Clinical Professor of Neurology at New York University, Grossman School of Medicine, and Indiana University School of Medicine. With that being said, please give a warm welcome to Dr. Brian Hainline. Welcome back to Concussion Corner, Dr. Hainline.
Well, hi, Jess. Nice to be with you.
It's a pleasure to see you again. We just saw each other not too long ago at Children's Hospital of Philadelphia. It was lovely to have you do the keynote there.
Yeah, it was really great. I mean, I actually gave 2 lectures that day. One was on mental health, and it was to the pediatric residents. And then I was part of their concussion conference, which was really awesome as well.
Yeah, it's so amazing to kind of have seen you grow and thrive, and just you're everywhere. So it's just wonderful that you are able to actually touch people again and inspire people to keep doing the work. So I'm so happy to have you on.
Yeah, no, it's my pleasure and glad to be here.
So it's been a few years since you've been on the podcast. We actually took a hiatus. We built a school. So we built an academy portion of the podcast, and it took a lot of work, but we're back here, and we, just want to make sure that we're able to facilitate next day knowledge translation to healthcare providers all over the world. Specifically interdisciplinary, and really get people motivated to translate that this research that's coming out of the work that you've been a part of the last few years, starting with the 2014 Obama administration. I remember that New York Times article and watching that live actually before my cousin's graduation in Long Island. So with that being said, let's kind of, reintroduce yourself, let our audience kind of get to know you again. And I would love to just kind of, kind of that origin story of becoming the chief medical officer of the NCAA, and then really where that impetus came with the CARE Consortium initiation at that point.
Yeah, sure. So I started in January 2013 at the NCAA as their first chief medical officer. Interestingly, the NCAA is the first sport governing body in the United States to have a full-time chief medical officer. And prior to that, the only sport organization that I'm aware of that had a chief medical officer was a part-time position, and that was actually the U.S. Tennis Association. And I was their chief medical officer part-time. So this came about, and I think it made a lot of sense, and really to put it in perspective, it's a new role. Sometimes people say, well, what took the NCAA so long? And in many ways, well, in every way, we were at the forefront. The only other international organization that had a full-time chief medical officer was FIFA. But then after the NCAA, quickly, then there was a chief medical officer position for the NFL, and then the NBA, and for soccer, and for Major League Baseball. So it's a relatively new concept. Importantly, at the NCAA, the creation of that was really to work with our membership committees, keeping in mind the NCAA is 1,100 schools and 500,000 athletes. It's a representative democracy. It's a governing body of sport, and really a representational democracy. So it's 1,100 people who need to vote on change. So it was a way for me to work with the membership, help them make informed decisions, learn from them as well, and really use that position to help shape policy, education, and even research when there was the possibility. So I was keen on looking at all three of those when I started.
And it was so enlightening to kind of see you speak at CHOP, because I remember, seeing you speak at NYU a very long time ago, maybe 2014, 2015. And I remember you starting off with, the three pillars of, we're looking at sudden cardiac death, concussion, and mental health, and how that's actually been extrapolated with the research and this huge team that you've compiled across the nation. So, the updated numbers that I saw in terms of epidemiology, we have you have 52,677 approximately, and then about approximately 5,000 injured athletes and service members with the CARE Consortium data so far. In terms of why is it so important to have an N that big in the world's first prospective study on concussion?
Yeah, so you first mentioned mental health and cardiac and concussion, and so we've actually taken different paths for those three entities and more. And so specifically with concussion, the primary path with regard to research has been working with the Department of Defense. And so that is the CARE Consortium that you mentioned. It's the NCAA-DoD CARE Consortium. CARE stands for Concussion Assessment, Research, and Education. And so what it is, it's a study across 30 schools and the 4 service academies. So at a typical school, let's say, well, it depends if it's a D3, D2, or D1, but, they all have 500 to 700 student athletes at typical schools. The Service Academy cadets have 4,000 cadets. So we enrolled all of the student athletes at a regular NCAA school, but every single Service Academy cadet at those places of education and training. And so that really allowed us to get a great depth and breadth within our study. And we're looking at all 24 sports. And so, before the CURE Consortium, 95% of the world literature was just dedicated to concussion in men. And most of that was American football and ice hockey. So this was an opportunity to look at all 24 sports. And with the service academies, it really expanded the depth and breadth of looking at concussion in female athletes as well. And when I say athletes, every service academy cadet is essentially an elite athlete. So it's really been great, and we're now 10 years into it. And so you might ask, why would we partner with the Department of Defense, and why even do a concussion study? So, we did a gap analysis, meaning we assessed what do we know and what do we not know. And we did this with the leading scientific experts from the Department of Defense and the NCAA. And we realized the knowledge gap was massive. We didn't know the natural history of concussion. We didn't know if concussions were the same in men or women. We didn't know if concussion was sport specific or if it varied according to sport. We had no objective biomarkers in concussion, meaning, other than clinical symptoms, you can't put up an X-ray or a CAT scan or an MRI and say, well, yeah, that's definitely a concussion. You can't do a blood test and say, that's definitely a concussion. So there were no objective biomarkers. So, and why the DoD, when you look at the demographics of the servicemen and women, it's so similar to the demographics of the student athletes, same age, athleticism, push themselves to a place of excellence. And they're all really pushing themselves to train and compete at a very, very high level. So that's what came about. And the other thing, really, when we look at what was going on around 2013, there were over 350,000 traumatic brain injuries from Iraq and Afghanistan. And there was a huge knowledge gap in how to manage that because of the knowledge gaps we discussed. So it was important to understand concussion. It was important to really provide an understanding so we could manage health and safety in our student athletes and in our service academy cadets. And ultimately, this spills over to society at large.
Yeah, and it was so interesting, to me. I remember that 2014 lecture you gave at NYU, and it really was salient for me as a physical therapist, right? Also as our persistent symptom concussion human at that time, about a year or two out. And, at that time, there were over 43 working definitions of concussion, with one of them being evidence-based. And I remember sitting in on a TBI conference in DC and learning that there were 0 phase 3 clinical trials for traumatic brain injury in the last 3 decades. And I'm like, well, how do we know what we're looking at if we don't know what we're looking for? And the importance of this understanding even just the natural history of concussion, I think, is so surprising to most healthcare providers. The American Physical Therapy Association just had our centennial year, and we were rehabilitative aides in the trenches, Brian. And what that means is that literally in World War I, we were literally in the trenches treating traumatic brain injury. And what did we do? We get those service members up, we get them moving. We don't tell them to rest and lay in a dark room. And literally, we started actually during pandemic times as a profession. So with that being said, you have over 55,000 folks enrolled through the DoD and the NCAA. Before we go on, why was it important for you and Colonel Dallas Hack, to join both NCAA and the Department of Defense in this study before we move on in our next topic?
Yeah, so Colonel Hack, retired Colonel Dallas Hack, Dr. Hack, he was really overseeing all the appropriations for traumatic brain injury research in the Department of Defense. So we met very early on in my tenure, and we looked at the similarities in traumatic brain injuries that the servicemen and women suffer and that our student athletes suffer. So when we looked at the military specifically, 80% of their traumatic brain injuries were mild traumatic brain injuries. So that's the general umbrella we use for concussion. And of those, more than 80% actually occurred in a way that was biomechanically similar to a sport-related concussion. So less than 20%, closer to 15%, were actually blast injuries. So we saw the demographic similarity, and then we saw that the majority of the concussions from the Department of Defense happened in a way biomechanically similar to a sport concussion in a student athlete, a collegiate athlete. And the big difference is that in the military theater, it's really hard to do a study. But at the collegiate setting, look, we have research institutions across the country. We do research all the time at our great American universities. It was a much more controlled environment to try to gather that information. So that's why Colonel Hack and I thought it was ideal to join forces and to do the study on the college campus.
Yeah, and how great, because now you're, unlike the Framingham study for cardiac care, we're looking at both male and female. So that's a longitudinal study that's completely impacted the way in which we care for our cardiac patients, which we know is so important. Any thoughts there?
Oh, I have a lot of thoughts there. I mean, you look at equity, and equity in healthcare has not been favorable to women. We just know those stats for a fact. You look at cardiac care, and there were data from a couple of decades ago that if a woman came to the emergency room with chest pain, she was more likely to be managed for an anxiety disorder, and a man would be managed to rule out an acute myocardial infarction. We know 30 years ago that for women who suffer with migraine and after puberty and before menopause, the ratio of migraineurs is about 4 to 1 women to men. And during my residency, I was taught that, well, that's just a convenient excuse for women, and with no thought whatsoever to the pathophysiology and how it might be influenced by estradiol and its interaction with the serotonergic receptors. So, there's a long history of inequity there. And I'm going to put my tennis hat on because I'm also very involved in tennis. This year at the US Open is the 50th anniversary of equal prize money for men and women, which is a landmark in the history of sport. And so, looking at the inequity, even in concussion, 5% of the research in the world was devoted to women. It's just not right. And it's a reflection of too many things that are not right in our society with regard to inequity between men and women. So, yeah, but don't get me started, Jess, but that's just the beginning there.
Yeah, I hear you. And I just saw that announcement at the Billie Jean King Cup, and it was just nice to actually see that was renamed. Brian, what was that? Is that the new date? Is that the Davis Cup, or what was that renamed after?
No, that's the Fed Cup. So Davis Cup started over 100 years ago. Fed Cup has just been in existence since 1960, I think 1963. So it started off being called the Federation Cup, Fed Cup for short. And it was just a few years ago that they renamed it the Billie Jean King Cup, really in honor of one of the greatest athletes in the history of sport, and the greatest advocate from a civil rights point of view of really pushing for equal access and equal pay for women, not just in sport, but in every walk of life.
Yeah, and my partner and I both played tennis, and we're just huge fans. I've been going to the Open since I was a kid, and I just remember being a little girl, and I played boys baseball in the Lower East Side of New York City, and they said no, and my mom said why, and I said I want to do it, and there was a fight, with the parents, and they said fine, she has to try out, and we can go on to Title IX 101. But I ended up playing a first-round draft pick, and then I had a one-handed backhand playing as a kid as well, and they said you have to use two, and I said why, and I was strong enough. So my partner and I both have one-handed backhands as females, but it's just, you've got to ask why. And it's lovely to see people advocate for all things Title IX and equity in healthcare and in life and society. So we appreciate you. In terms of, as we finish up this first episode, I'd like to kind of talk about the prospective longitudinal study in the first 3 phases of care. When you came on the first time in 2019, we were talking kind of about care 1, the acute natural history of concussion and head impact exposure. I'd love to hear about, how phase 2 went into care 2 plus Saltos, and then how you're transitioning into phase 3.
Yeah, so you're right. Care 1.0, we call it, was about the acute effects of concussion, repetitive head impact exposure. And it was looking at it from a clinical point of view, but also the 6 schools who were doing highly advanced research. So within the 30 schools of care, 6 schools did very advanced research for doing biomarkers like genetics, genomics, inflammatory biomarkers, other proteinomic biomarkers, and looking at MRI data, head accelerometer data, and so forth. So CARE 2.0 was looking at persistent and cumulative effects of concussion and head impact exposure. So not what happens within the first 30 days, but what are things like 6 months later and a year later, and carrying it out really up to 5 years. And within CARE 2.0, a very specific study called SALTOS emerged. So SALTOS is the Service Academy Longitudinal Traumatic Brain Injury Outcome Study. And the principal investigator for that is Paul Pasquina. So, and Paul really synced that protocol completely with CARE, which was looking at the NCAA student athletes. And so then you had CARE and SALTOS working side by side, collecting very similar data, looking at similar outcomes in the Service Academy cadets and the NCAA student athletes. So we've completed CARE 2.0. And right now, the principal investigators are doing all of the crunch work in terms of data analytics and publishing. And what's important to state here is that even though I was very involved in helping to shape the creation of this study, I have no access to the data. There's a firewall between the data and me. And the only time I become aware of the data is after it's been fully vetted and approved for publication and it's ready to be published. So I think that's really a great way to go. Would have been nice to, publish 60 or 70 papers and have it on my academic record, but that wasn't the right way to go. So we finished CARE 2.0, and now we've moved into what's called CSI, CARE SALTOS Integrated. And we're taking that and we're studying. So we have 55,000 athletes enrolled, and in a randomized manner, we're looking at different groupings of athletes at different points in time. So every year we're gathering clinical data, and then every couple of years we're getting much more in-depth data, which includes brain MRI and more biomarkers, and we're actually adding PET scans as well. And so it'll be randomized, and there will be some people who have had no head impact exposure whatsoever, some who have had some who have had concussion. And so we're looking at the variable outcomes over a period of 5, 10, 15 years. But even just as importantly, perhaps more importantly, for the SALTOS arm of this, the Service Academy cadets that we're following out through their military career, we'll have access to their medical records. So we don't have access to the NCAA graduate medical records once they've graduated. That's just how the association is constitutionally. But to have access to the medical records, we're not just looking at if someone's had a concussion, if they've had head impact exposure, or if they're just training at an elite level. We'll know, has someone developed a metabolic syndrome? For example, obesity, diabetes, hyperlipidemia, hypertension, cardiovascular disease, because we know that has a huge impact in shaping brain health and really in shaping it from a negative point of view. Or if someone has developed a history of drug use or alcohol abuse, or if they develop a neuropsychiatric disease, all of these things shape brain health. And so part of this CARE SALTOS Integrated is also helping the Department of Defense with a huge initiative they have. It's called the Warrior Brain Health Initiative. And it's essentially, how do we understand what allows for brain health in the short term and the long term? Because essentially, we would like all of our servicemen and women to be in a place of cognitive and physical dominance, which is, by the way, that's what every athlete wants to do, to be in a place for. So it's really, really wonderful how it's shaped out, and we've really exceeded all of our expectations across the board.
As we finish up here, Brian, before we head into episode 2, I just kind of want folks to kind of lean in with us. We're going to talk about how this data is changing the way in which we both practice and research and think of new questions. In terms of the trickle-down effect, why is this research important? And we'll finish up episode 1 with this question. Why is this research important for our youth athletes and for little boys and little girls across the country and the world?
Well, I think, it's the best research that's ever been done on concussion, hands down. And so you can extrapolate, not 100%, but you can extrapolate what's good for a collegiate athlete could be good for a high school athlete. But the other thing is that now there are some studies that are replicating CARE at the high school and youth level. So that's really cool. And the other thing I'll say, I think it's a nice way to kind of come to closure on this, is that all of the care data gets uploaded into Fitbeer. So Fitbeer is jointly managed by the National Institutes of Health and the Department of Defense, stands for the Federal Interagency Traumatic Brain Injury Registry. And that is a public data storage for all of the concussion research in this country. And 80% of that actually has been filled by CARE. And so even though the principal investigators are working hard to assess the data, we have made this publicly available, and then the scientific requests go through the NIH and the DoD through Fitbeer. So other scientists can look at this data and maybe gather other insights that the principal investigators might not have thought of. So this is incredibly transparent and open, really, as a societal good.
Excellent. And I can't wait to see this knowledge translated. Again, our mission here at Concussion Corner podcast is really a teach one, serve many. And if we can just inspire people to get access to this information, it's available. Hopefully we can inspire people to lean in and start, again, I had no idea about the high school and youth level mini care going on. So that's amazing to hear and see. And if people want to learn a little bit more about the Sports Science Institute at NCAA, we'll put that into the show notes. Any final thoughts before we head out into episodes 2?
Well, I think the final thought really is just the incredible privilege I feel in collaborating with the NCAA member schools and the Department of Defense. It's just opened my life in so many ways. I didn't serve in the military, and to become friendly with and understand the dedication of our military servicemen and women, it's just been incredibly, I feel blessed. It's just been a phenomenal experience, and also just understanding how collaboration really works, and that's what I've really experienced at the NCAA, is just collaboration across the country for the common good, and in this case, the common good is the health and safety of our student athletes.
Excellent. Well, Dr. Hainline, thank you so much for coming on to Concussion Corner, and we'll have you back on for episode 2. Have a great day.
Thank you.
Thank you for listening to the Concussion Corner, hosted by Dr. Jessica Schwartz. The information in this podcast is for entertainment purposes only and not to be used as personal medical advice. Don't forget to follow us on social media on Facebook, Instagram, Twitter, and YouTube at Concussion Corner.